Okay, so first I'll start off the video with a view of my entire room. So here's that back wall. And then here's that corner. Okay, so this is my patient. I'm actually gonna have you sit on the edge of the bed right here. Or just stand, you can stand on the side. Sit on the side. Okay. And so first thing I'm going to be doing in this assessment of the neurosystem, I don't know if I said that yet, but this is assessment of the neurosystem. So I'm going to be performing hand hygiene. So I would wash my hands, don gloves, and then the first thing I would do is assess her physical appearance. So I'm looking at her facial expressions and her what is it? Sorry, I'm trying to pronounce it right. And her affects. And then the second thing I would be doing is assessing her communication. So I'm going to have you tell me what's going on in this picture right here.
It's a man.
You can hold it.
It's a man walking his dogs.
Yes. And so then she was saying that, I would be assessing her her voice and then her articulation of words and her speech. And so next thing I'm going to be assessing is her conscience, how conscious she is. And so I'm going to be asking her what your name is.
Coco.
And where are you right now?
In the hospital.
Okay. And then I'm going to be asking what day it is.
Tuesday.
Correct. And then I'm going to be assessing the Gasco coma scale. So I'll be rating her eye opening, her voice, and her speech. So, and then I will be assessing her memory. So could you tell me what you ate for breakfast this morning?
Waffle.
Okay. And then I will be using light touch. And so for that, I'm just going to be touching different parts here. I'll move this lower. Okay, just back up some on the bed. And so I will be touching different parts like her legs and her arms, and I'm going to see, and I'll have you close your eyes, and I'm going to have her say if she felt that and where she felt it.
Yes.
Where did you feel it?
My shin.
Right or left?
Left. Yes.
Right or left?
Right. Yes. Arm. Oh, yes.
Right or left?
Right.
Okay. Next thing I'm going to be doing is superficial touch. So I'm going to be asking her if the touch she feels is dull or sharp. So this will be the sharp.
Sharp.
No, I'm just saying this will be the sharp touch, and then this will be the dull touch. Okay. So I'm gonna have you close your eyes, and you're gonna tell me if it's dull or sharp. 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 Sharp.
Duty. Soft.
Dull or sharp?
Oh. Dull. Sharp.
Just say.
Can you do it again? Dull.
Sharp.
Dull.
Okay. So the next thing after that is I'm going to be testing her motor and position. So I'm going to have you put your hands out like this. And so I'm going to be using her index fingers, and I'm going to be I'll have you close your eyes, and I'll be going up or down, like this with her index fingers. I'll be doing it with both. And tell me if when you feel your index finger going up or down, if it's up or if it's down. Okay, so up, down, up, down. Perfect. So now we'll do it. Keep your hand raised with this finger. Up, down, up, down. Okay, and I'll also be doing that with your big toe. So, if you can see this, I'll raise her foot so you can see that. So close your eyes. Down, up, down, up, down, up. Okay. Down, up, down, up. Okay. And then the next thing I'm going to do after that is your sterenosis. So if you'll put your hand out, you can do both. And then, so I'm going to be putting an object in your hand, and your eyes will be closed. And you're gonna tell me what the object is. Okay? Okay, so close your eyes. Fuzzball? Okay. Popsicle stick? Okay. And you can open your eyes. And then I will be testing your extinction. So I'm going to be, I will have you close your eyes, and then I'm going to use both of my fingers, and I'm going to touch somewhere like on your legs or your arms, and you'll tell me if you feel both fingers, if you feel both sides, or just one side, like your left or right. Okay, so I'll do that now.
Both. 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 One.
Right or left?
Left. One.
Right or left?
Right. Both.
Okay. Okay, next thing after that is I'm going to be assessing the, sorry, I'm trying to think of the name. I'm gonna have you stand up, and I'm going to have you put your arms out with your palms up, and I'm going to assess that for 20 seconds. Okay, and then you can put your arms down. And then next thing I'm going to be assessing is your romper. So you'll just put your hands on your side, have your feet together, and then I will have you just close your eyes. Okay, you can open them. And then, okay, and then next thing I'm going to be looking for is I'll be assessing your I'm trying to remember. Coordination. Okay, so you can sit down for this, and I'm gonna have you put touch your nose and then alternate. Keep alternating. Okay, and then you can stop. And then I'm going to hold out my index finger, and you're going to touch my index finger with your index finger. No, and then I'm going to move it, and you're going to have to touch my index finger. Okay, next thing I'm going to be doing is a knee to shin assessment. So I'm going to have you put your foot, bring it to your knee. No, like put your foot on your knee. Put the edge of your foot on your knee. And then you can kind of put your foot out like this. And then, yep, and then you're going to slide it down your shin. And then you're going to do that with the other foot. Okay. And so after that, I'm going to be doing a don't worry, it's coming to me. And so after that, I'm going to be checking reflexes. So I will be doing your radial first. Okay, and then I'll be doing bicep. So I'll have you put your arm out like that, and I'm going to put my thumb over the bicep tendon. Okay, and then I'll be doing the tricep. So I'm going to hold your arm like this at a 45-degree angle, and then you can kind of dead weight your arm. And the tendon's right above the elbow. Okay. And I'll do the same thing with the next. Okay. And then I'll be doing the knee, the the platena, and so that is right under. So it's right underneath the knee. And then I'm going to be checking the Achilles tendon. So I will be using the pointed for that, and it's right above the Achilles. And then the next foot. Okay, and then I will be checking the plantar. So for that, I'm going to be using the other side and going up the foot towards the big toe. So this is superficial. Okay, and then the next. Okay, and then I'll be doing. And then the next one. that would conclude my neuro assessment, but I did miss one thing. So I missed two things that what I would do before I ended. So I will have you sit back down, and I'm going to assess motor strength. So I'm going to stick out my two index fingers, and then I'm going to have you squeeze them. Okay, and I will be looking for symmetry there. And then I'm going to put my hands above. You can kick your feet out, both of them. And I'm going to put my hands above the toes, like this. Here, kind of do worse I can see. And then I'm going to have you push up with your feet. Okay? And then I'm going to put the bottom of their toes and then push down like you were pushing on a gas pedal. Okay. Okay, and that concludes my neuro assessment.